It is 7:45, and in health news this morning, there are plenty of confusing messages out there about the safety of vaccines. But one local retired doctor decided to do something about it from the grassroots level, telling us he never imagined his idea would go, pardon the pun, viral. Senior health correspondent Monica Robbins joins us at Studio B for more. Good morning, Monica.
Good morning, Janita. Many physicians from the 20th century will tell you vaccines were among the greatest medical advances. One of the reasons is because they lived through the days when there was no treatments for some of the diseases the vaccines prevent. Joining me now is Dr. Arthur Lavin, a grandfather and retired pediatrician, and Patrick Crago, who is a polio survivor. Thank you so much for being with us.
Thanks for having us, Monica.
Dr. Lavin, I'll start with you. You started an organization called Grandparents for Vaccines. Why did you start this organization, and what was the impetus behind it?
Well, thanks so much for having us again. You know, the impetus came from me being a grandfather. I have 4 beautiful grandchildren, and I can't believe that we're living in a world where they're under threat from these diseases that we vanquished coming back because people have chosen not to protect the grandchildren. So I felt like it was important for the United States to hear the voices of grandparents for 2 reasons. One, the grandparents lived through these diseases. Parents today don't have memory of polio, measles, and meningitis and such, but we grandparents do, and we want to share our stories, but we want to share our stories so people can gain an understanding of why it's so important not to bring these diseases back into our life.
When did you start this organization, and since then, it's grown viral? How?
So we launched on Grandparents' Day this year, barely over a month ago, September 7th. And within 24 hours, we had national coverage. We've had tens of thousands of people come to our social media platforms. 5,000 people have signed up. We're getting hundreds of grandparents sharing the most extraordinary stories. You're going to hear one of them today. But stories about what really happens if we drop protections for our grandchildren. The grandparents really just want our grandchildren to be safe.
Mr. Crago, you are a polio survivor. Why do you think it's so important that people hear your story?
Well, I think it's for the same reason that Arthur said. People these days don't have any experience of the diseases like polio. And so it's hard to be wary of them, to understand the need for the vaccines.
How old were you when you were diagnosed?
5.
And what happened?
Well, I was unable to walk, and they took me to the doctor. He thought he didn't understand that maybe it was polio yet, and so he sent me home for a couple of days. And when they did decide that I had polio, they sent me to the hospital in Pittsburgh immediately, and they quarantined the family for a couple weeks. Wow. And one of the stories my sister said was, I lived on a farm. People from the city came to pick potatoes on the farm. They saw the quarantine sign and sped off because they understood the consequences. I was in the hospital in quarantine also, so I didn't see my parents except through a window for 2 or 3 weeks. And I spent like 3 months in the hospital in acute care, if you will. Then I spent another 11 months in a rehabilitation hospital to have to learn to walk again, to take care of myself. I started 1st grade in the hospital, and finally I went home and went back into regular school.
And obviously it has, you are one of the few survivors left because so many polio survivors are no longer with us. But your story is so incredibly important because no one has seen polio.
Right. That's exactly how I feel about it.
If grandparents want to reach out and find more about your organization, what do they do?
That's easy. Just go to grandparentsforvaccines.com. We're asking people to do 2 things. Join us, there's a button to join us, and share your story.
Okay, all right, both of you, thank you so much for being with us and sharing your information. I think it's important that people hear that. Even people who aren't, familiar with vaccines or aren't sure they want to, I think it's important for people just to get more information.
Thank you.
All right, back to you guys.
All right, Monica, information was definitely needed. Thank you so much.